shaking all of that.
Hi, so this is a day in Jen and Gill's life in clinic. We're going to do Dermapen. She let me record it. So much so she's actually holding the phone. So it's that bad. But we're going to do the neck. I'm going to do 0.75. We've got hyaluronic acid on and some B vitamins on. I'm going to be quick so her hand doesn't get too sore doing that.
I go to the gym.
She goes to the gym. She's strong. The key thing I want to show you here is A, how quickly it is, and Jill's reaction, to be fair, because the idea is that this isn't painful. It's not comfy, but it's not painful. We'll ask Jill, see what she says as I go along. So I'm coming into the neck first, just because we can and it's easier for video. Again, fantastic to do this sort of bottom bit of the neck. Sort of sit, bear with me. Tilt, that's it. It's about you, not me. So there we go.
And it's
what do you think?
Not painful in the least. It's not, I mean...
Scratchy?
I don't even feel that really. It's, yeah, slightly scratchy, I suppose, but nah.
Yeah. So we're getting a nice pink erythema. You might not be able to see on the camera, but there's a little bit of blood spotting, which is what I want, just to make sure I've got the right depth.
Keep checking the camera.
Keep checking the camera. We're all right. We're doing all right. Oh, got a cable on your face. I'm trying to do health and safety. You're on the camera. Honestly, I hope people appreciate this. There we go. Coming round.
I just ought to say,
yes,
folks here, that when you come to Jen's, you do have a bit of fun too, you know.
Yeah, it's so, not all torture.
No. It's a bit of a laugh, and that's not to say she's not very professional. She is. But
yeah,
she does make it a bit of fun.
I've got gloves on.
But it's the same thing. You know, you hear me say I'm going to the gym.
Yeah.
But if I don't like the instructor, it doesn't make it fun. I don't go.
No, it's important, isn't it?
So, and it's like going to a hairdresser. So if she say a flipping word to you, you'd think, well, that was,
you know, I get obsessed when people talk about treats, and I say, well, why does a treat always have to be sugar-based, you know? This, to me, as much as we're
this is a treat.
This is a treat.
Eat your sweetest, mate.
Exactly. I just sort of think, well, therefore it's important for me to make the experience as nice as possible.
Yeah, it's fun.
Even though, as you all know, I cause a lot of trauma. But the results, I'm afraid, outweigh my concern about causing trauma. Now, can you... Yes, you can see. Don't do that.
I'm not yet. I'll stay where you are.
There's a little bleed here. This is what I mean by pinpoint bleed, okay? I've hit the right area in the skin, I've caused the trauma, and it's just come to the surface. She's not bleeding, it's just what we call a pinpoint bleed. Absolutely perfect for the neck. Oh, I'm a genius.
You are that, dear.
I love doing this treatment. Probably not as methodical as I used to be when I first learned.
Well, yeah, but that's all part and parcel of not being nervous anymore.
Yeah, I
suppose that's part and parcel of knowing exactly what you're doing, I think.
Yeah. Okay, come up here and then you can rest that down. So again, the great thing is you can get right over a throat area there and the Adam's apple. This bit here, this is always what I see on ladies, that bit that drops. Fantastic treatment for that, and especially under here as well, where it puckers around the collarbone. Perfect treatment. You can relax your chin down a tad. Oh, that's fine. Now, I'm keeping the depth of the needle quite deep as I work up the cheek, mainly because this skin is quite nice, thick skin, and also we're still going for the lift around here, so I'm still looking for that pinpoint bleed up and around the cheek. Similar to the HIFU, going in the same direction. Obsessed about the lift.
Which if you were watching earlier, you'd have seen.
Yes. Video 4, video 5.
Just to show you, actually, that you can do one after the other. If time is short.
If time is short, we rack and stack.
Yeah.
Well, this is it. I mean, it's like when we do the cryolipolysis with the fat freezing. My hands are pretty free, so most of my clients, they'll have their tummies done and we'll do this at the same time. I mean, why not?
Day's going to come, you know, when you just walk into the freezer.
Just freeze ourselves. So now I'm going to do the chin here. We were talking about this earlier about the orange peely effect that comes up, that builds on our chins as we age. Yeah. We're also talking about the little lines that we get on the top of the lip here. This is fantastic for all of those things. We've just done the HIFU, so we've lifted around here, so we've already worked this, but I'm still going to work the sort of wrinkle and break down the cell wall there to give that a renewable, some fresh cells. And then we come round the nose and up the side of the face. So I drop it down to about 0.5, 0.25, because it's harder skin and you've not got the thickness, but I'm still going to the same depth. That makes sense. So I'll still get a little bit of a bleed on here. Perfect. And then you can come right on the lip. Some of my ladies really like it on the lip. If you've got a tattooed lip, perhaps I wouldn't do it because I don't want to break down that ink. But if you've got the lines and you really want me to work it, I can. Again, a bit like the HIFU we were saying earlier. Not the nicest of treatments on the top lip, but it's a bit like, well, we have to, don't we?
As I say, to me, I don't feel it, no. Whether it's because, I wonder if having had the HIFU...
Yeah, you're immune.
I don't know about that. That's strange, isn't it? You'd think, in fact, having had the HIFU, it would be painful. But no.
You know, it's not the night to go out on a date night with Bob, is it? Tonight?
Oh, really? Oh, heck, now you tell me. No.
Having all this done to your skin. And I'd never do this on skin I've never met before, without a doubt.
Why wouldn't you?
Because I don't, you just...
Don't know how it's going to react.
It's going to how it's going to react. I've worked with Jill's skin now for 18 months.
Yeah.
Yeah. We've had some great fun. So have you ever had roller needling, derma roller? Or did I introduce you to dermapening, to needling?
Yeah.
So the issue with rollering, or the difference with rollering, is I'm going in and out really fast. You can hear it. What rollering does, it comes in and it comes out, and where we get in this pinpoint bleed, what happens is the skin is kind of closing straight up again. So I've got the trauma without damaging the epidermis. Unfortunately, with things like derma roller, you can potentially scare the epidermis, tear the epidermis. So you know what your body's got to do, what your skin's got to do, it's got to heal that epidermis, let alone get collagen to the site. And as I've learned, don't ask things to do too many things at once.
And would you get a scab from that?
Yeah, you can get scabs, and you can also, when I did it on my side, you can also get bubbles under the skin, where the bacteria gets under the skin and the skin goes over the top. I mean, it was a long time ago since I've done them, so I'm not sure if there's different protocols now to prevent that.
You don't actually see it very much now, do you?
It's a bit like we were talking about earlier about
Casey.
Yeah, about Casey and about microdermabrasion. It's a cheaper treatment than this. And well, the other thing is that people can do it themselves at home, whereas obviously they wouldn't choose to do this to themselves, unlike me. And so people like doing things themselves, which for me is a worry, because of course then you've got the hygienic aspect, and then there's also the overdoing it, which is a common problem.
The only thing I do for myself is the odd, well, it's only odd, I mean, occasional face mask.
Yeah, I agree. Some nice masks in between treatments. You know, you don't really need to keep stripping your skin back. You know, people forget what skin's designed to do. You know, it's designed to keep stuff out. It's designed to be waterproof and keep stuff out and protect you. So, you know, opening it up all the time and shoving things inside it, you're sort of breaking its rules. You've got to work with it, feed it casually. So this is what we were talking about earlier on the eye. So with the HIFU, we went up and round the eye here. With the needling, 0.25. We can literally, similar, lift the eyelid and then work the skin The weirdest thing I found about this is it actually just makes the vibration of the pen makes your eyeball wobble a bit. That's
What?
about it.
Again,
She can't feel a
not
thing.
noticing it at all.
Coming at this up and over and round actually. Strange angle. So I'm going to go deep again on this cheek. Text messages coming through on my phone.
You know, I told you I did that radio interview yesterday, and normally I don't wear makeup at all.
No.
But I thought, God, well, I mean, even though it's a radio interview, I thought, well, I'd better make an effort.
Yeah, just in case.
The foundation, all it seemed to do was cake itself on, and I didn't look. It was like a mask. It was like a mask.
Yeah.
So what I ended up doing was using tissue paper to blot it all off.
Oh, God.
That's what I'm not going to clean it. Blotting it all, and just concentrate on my eyes and.
Yeah. You don't need it anymore, do you?
No. I mean, even the forms, I thought, well, should I put blush around? I just looked and thought, no. It's all there.
Well, this is my thing. My claim to fame. After 6 months of working with people, I always say, you'll have when we get started, I say, by 6 months you won't be needing to wear makeup. I mean, you can choose to put it on if you like, but...
Well, I just found it wasn't enhancing it.
No. So all I'm doing now is ever so lightly on the front. So I've done all my stimulating my collagen, I've done my skin tightening, I've made a lovely mess of a skin. And all I'm going to do now is a ever so light sort of wash, as I call it. So 0.1, 0.2 on the needle, and I go all the way over the top. And this is for brightening. So it's very good for getting rid of any pigmentation, anything that's kind of left in the skin. So I do love doing this. It's kind of nice overall sort of swoosh. And it doesn't get sore, does it?
No.
It's not, oh God, she's going again.
No.
Well, no one's complained. The foreheads, I think, I get the most complaints about.
Have you done my forehead?
Yes! It's got little bleeds on
I
it.
don't feel it. Yeah, you see, you said the same about the upper lip. I didn't feel anything there either.
Yeah, just a quick swoosh all the way around. A nice trick is to go into the hairline as well. And kind of helps to tighten the skin past the hairline. Again for the eyes. I don't know if I did this eye. I'm sure I did. The little wrinkles we get around here, you get right in here. It's fantastic for this. So you can't do this with a roller. You can't get in here because you're limited by your roller size. Big thing at the moment, dark circles around people's eyes.
Oh, I'll tell you who I'd like to sort out. Is Theresa May.
Oh God, yeah.
I mean, those eye bags.
Oh my God, poor woman.
I mean, I do appreciate that she's not got the easiest job in the world.
She could have a double do.
Oh,
Get her
what?
in here, eh?
I admire the woman just for her sheer determination and tenacity. Because if it were me, I'd be sobbing my socks off by now. Yeah. I'm not going out there again.
Yeah.
It's Cameron Mendes, all but say nasty.
She's always got some really nice jewellery on, doesn't she?
Yes.
She wears that big thick jewellery well.
What I would do if I were her dresser, I'd stop her wearing those little short jackets.
Oh, okay.
Because it makes her look shorter waisted.
Yeah.
And she is short waisted.
Yeah.
But she should wear a straighter
longer.
down to the hip jacket rather than.
Yeah, she's got quite a masculine figure, hasn't she?
Yes, and she's got great long legs, and she's got fabulous legs. And she could actually show them off by coming further down to the hip.
No, you're right. It is nice. She does dress well. It's nice to see a well-dressed lady on television. Yes. It's quite
and she
rare.
bothers with her makeup and all the rest of it. I think she's.
How long was that? 14.47 seconds.
Fantastic.
Fantastic.
Look how pink and gorgeous I look.
Look at
Fresh.
that. Nice,
Fresh as a daisy.
Fresh as a daisy. So I'm going to put on one of my thingy masks. Bear with. Forgot to get it out. Love these. These are one of my little ghost masks. It's full of zinc and B5 and B6, so very similar to home nutrition, healing. Zinc, excuse me. Anything that has zinc in is for healing. And B5 and B6 is for energy and metabolizing. So what we're looking to do here is give the skin energy to allow it to repair. And then the zinc also will support that for you. So hence trauma, skin, zinc repair.
So if you eat zinc, is that also good to repair?
Yes, and you're going to ask me now, what's zinc in, aren't you?
Yeah.
I'm going to say nuts is my instant reaction.
Nuts.
Nuts and
I love nuts.
green leafy vegetables.
Oh.
It's the standard answer.
Oh.
Whenever we were at uni,
Whenever I do fish,
coming in.
I always lay it on a bed of spinach.
Ah, nice.
It is a lovely compliment.
There we go. Yeah, when we were at uni, it always used to say, you know, what's the answer? And it was always zinc or broccoli. It's never a tricky question, just put broccoli or zinc. Or green leafy vegetables. What's the other thing? Ooh.
Good job I haven't got my eggs in.
Yeah. Oh, I wouldn't have done it. This mask is divine. And very nice after the pen, isn't it? Kind of calming. There's definitely a moment of, and relax. So the skin is open. We say it closes straight away. There's about a 20-minute window where it's sort of at its most vulnerable, and this is where we put the mask on for that sort of period of time where possible. You can tend to feel when the mask has done its time because it goes dry. Not bone dry, but it definitely has sort of.
Do you sell these masks?
No, I don't actually. No, you can get. I do a BR one when we do the premium facial. BR ones full of collagen. Remember the bathing in collagen? They're sellable. They're 60 quid. Be naughty, but you can get 2 goes out of that. So yeah, I do like using that one on the premium treatments. But yeah, they're about 25 quid. These are. I suppose I could, but they are good. But super for this, so nothing's kind of going too far into the skin, causing us any trauma. Just sits on top, nice and cool. And we'll sit here for 20 minutes. And we're going to do a selfie in a minute.